So we are very excited to have a study at our institution combining our three most effective therapies in CLL. So, of course, the BTK inhibitor Ibrutinib and the BCL2 inhibitor Venetoclax, which are now in combinations just as the doublet. We have a triple therapy combination that includes Obinutuzumab, the anti-CD20 monoclonal antibody as well. And it's a little over a year of fixed duration treatment. We've had this study ongoing for several years, and we actually had 25 patients in a relapse refractory cohort and 25 in a previously untreated cohort, where we now have 4 years of follow-up data, which I think is really important just because triplet and this doublet combinations with BTK inhibitor Venetoclax are now, at least the doublet, hopefully going to be approved. So it's important to see with this fixed duration, like how durable these responses are. And it was really great to see when we looked at the data that really remissions do remain durable after treatment completion. So at 4 years of follow-up in the relapse refractory cohort, the progression-free survival estimate was about 85%. This was 96% in previously untreated patients. So that's very favorable when you think about 1 year of treatment and a lot of time kind of after treatment where people are remaining in remission. The other thing that we're presenting at this meeting that's new for this study is we actually have a third cohort of previously untreated patients. So this is an additional 25 patients receiving their first treatment with this therapy. So that kind of just adds to the number of untreated patients that we have experience with giving this combination. And the overall response rate was actually very similar, and the rate of minimal residual disease negative or undetectable complete remission was 20%, which was similar to the 28% seen in the prior cohorts. So that really supports that we are achieving these deep remissions. The overall minimum residual disease undetectable rate, when you look at both the blood and the bone marrow at the end of treatment, was even higher, of course, because that was complete remission with no detectable CLL cells. And that was about 50% in our original relapse refractory cohort, and right around 65 to 67% in our previously untreated cohorts. And that's no detectable CLL in both the blood and the marrow. So we did see in our new cohort similar safety, similar efficacy, and then, again, we don't have as long of a progression-free survival for the newer cohort, but I think one of the really main important things is just at 4 years, these remissions are very durable, especially in this treatment-naive setting. We've got a 96% estimated progression-free survival.